Okay, so Wavefront, aberrometer and slit lamp method for evaluating toric IOL position in realignment surgery by Dr. Senthil Prasad. I think you're maintaining with the timings. The 6 minutes is the time allotted. Yeah. With me is Dr. Sandeep and Dr. Soni George. They'll be again judging you all. So I think Dr. Senthil is ready for the presentation.
Yeah.
Thank you.
Good morning all. So I'll be presenting on Wavefront, aberrometer and slit lamp method for evaluating toric IOL position in realignment surgeries. So I don't have any financial disclosures. So the effectiveness of toric IOL will depend on correct intraoperative alignment and postoperative rotational stability. So any toric IOL misalignment will lead to loss of astigmatic power. Like 1 degree of misalignment will lead to a loss of 3% of astigmatic power. And when a toric IOL is misaligned of around 30 degrees, it won't have any astigmatic correction. When the toric IOL rotates more than 30 degrees, then it induces new astigmatism. So patients with gross misalignment and suboptimal visual recovery post toric IOL implantation will require realignment surgeries. So some of the methods to evaluate the position of toric IOL in the postoperative period include the common method, which is the slit lamp method. Then we have retroillumination photographs, which are superimposed on axis markings. Then we have the corneal analyzer system. We have some software-based analysis in which the photographs are uploaded to a software and then they tell you the position of toric IOL. Then anterior segment OCT can be used to assess the position, and ray tracing aberrometer. So the advantage of ray tracing aberrometer is it can even assess the position of toric IOL in undilated pupils. So we devised a study to compare the effectiveness of two methods. One is an subjective method, which is an slit lamp method, and an objective method, which is Wavefront aberrometer method, to assess the position of toric IOL in the postoperative period. And we also try to document the outcomes of toric IOL realignment surgeries. So it's a retrospective study. All patients who were implanted with toric IOL were assessed on postoperative day 1 and 14. Every patient was subjected to subjective refraction, detailed anterior and posterior segment evaluation. All patients, the toric IOL were evaluated using the slit lamp method and the Wavefront aberrometer method to minimize observer bias. So the slit lamp method was always done first. So slit lamp method, the patient was asked to look at a distance and ensuring that there is no face turn, head tilt. Then a thin slit beam was rotated until it aligned with the toric marks. Then the axis was noted from the slit lamp. So we used the iTrace Wavefront aberrometer. So it had an toric check display, which is an inbuilt software. So it will provide data regarding the axis of placement, the objective refraction, and what is the clockwise rotation that is required to correct the misaligned toric IOL. So this is the screenshot of the Wavefront aberrometer's interface using the toric check display. So the parameters are given the left bottom. So we'll just magnify it. So it gives what is the corneal astigmatism, then what is the implanted toric IOL's power at the corneal plane and the position of toric IOL, and then the current astigmatism of the eye, and then it predicts an estimated residual astigmatism post realignment of the misaligned toric IOL. So it provides an objective refraction, which in this case is around minus 3.5 diopters at 43 degrees. Then it suggests a rotation of 78 degrees and predicts a change in around 3.42 diopters in the eye. And post rotation, it estimates a residual astigmatism of around 0.07 diopters. So this is how it gives the values. So we included patients who either have more than 10 degrees of misalignment or patients with uncorrected visual acuity of 612 or less, and then they accept cylindrical correction in subjective refraction, and then we predict at least 2 lines of improvement in Selen sort of uncorrected visual acuity. So all realignment surgeries were done within 2 to 3 weeks of primary surgery. So we aligned the zero axis of the Mendes gauge with the position of the toric IOL, and then the corresponding values which were given by the Wavefront aberrometer were marked with the dye on the cornea. Then 2 paracenteses were made, and using bimanual irrigation aspiration cannula. So with in irrigation mode, the aspiration cannula was used to dial the toric IOL and align it with the marks on the cornea. So this is an example where post realignment surgery we taken the Wavefront aberrometer data. So same data, it shows what is the corneal astigmatism, the IOL power, the astigmatism correction of the IOL at what axis it is. Shows the IOL is at 140 degree now. So when you see the data over here, it suggests only 1 degree rotation, which means almost the toric IOL is aligned to its perfect axis. So we evaluated around 4,721 toric IOL implantations during the 3-year study period, of which 63 eyes met the inclusion criteria for toric IOL surgery, of which toric IOL surgery or realignment surgeries were done in 55 eyes. We included 52 eyes in the data because 3 patients had incomplete data. In 8 patients, the realignment surgery was deferred, like they were either not willing to undergo other surgery or they were happy with their post-operative vision. So the mean age of the study participants were 60.3 years, and the realignment surgeries were done at an average of around 2 weeks from the primary surgery. So misalignment was calculated as the difference between the planned IOL axis and the current axis at the post-operative period. So we found that Wavefront aberrometer had a mean misalignment value of 47.1 degrees, whereas using the slit lamp method, it was found that the mean misalignment was around 44.9 degrees. So there was no statistically significant difference. Similarly, post-operative period also, there was not any difference between the degrees of misalignment calculated either through the Wavefront method or through the slit lamp method. So we plotted the values in a bland Alpine plot, and it also showed that there is agreement between the two methods. So similarly, intraclass correlation also showed almost perfect agreement, and we could see that improvement in cylinder, which reduced from minus 1.5 diopter to 0 diopter in the post realignment period, with a corresponding improvement in visual acuity from uncut at 618 to 6.6. So toric IOLs are effective means to correct astigmatism, provided they are in the correct axis. We found that realignment surgery significantly improves uncut visual acuity, and it reduces the subjective cylindrical correction refraction. And we found that the slit lamp method is as good as Wavefront method for evaluating toric IOL surgery. Yeah. So other studies also found that other methods were compared with slit lamp method. Conclusion: toric IOL realignment surgeries are safe, improves visual acuity, and reduces the refractive cylinder. Slit lamp method can be used in resource-constrained settings to evaluate the position of toric IOL as good as other methods. Thank you.
So you are a non-ratified member.
Okay.
So marks will not be given.
Okay.
Right?
Next speaker available.
Thank you, doctor.
Thank you.
I request the audiovisual people to please show the timing marker here as well. Okay, it's not being projected here in this. Here.
It's down
It was
there.
not. It was not showing.
Okay.
It was not showing. It's 0.06 only since beginning.